Working in health and social care, promoting equality, diversity and rights. Introduction to the module. This module will explore equality, diversity, and rights in health and social care. These are issues that you will face on a daily basis, so you must be aware of them. This module will teach you how to help a victimized person and help a person responsible learn not to do so. It will also cover prejudices, as well as your own rights in your place of work. Topics to be covered. This module covers the following topics. Understand concepts of equality, diversity, and rights in relation to health and social care. The benefits of diversity. Health and social care settings. Active promotion of equality and individual rights. Individual rights. Discriminatory practices in health and social care. The effects of discriminatory practice in health and social care. How anti-discriminatory practice is promoted in health and social care settings. Personal beliefs and value systems. Understand concepts of equality, diversity, and rights in relation to health and social care. Equality means that people are treated fairly and equally. There should be no discrimination on the basis of age, race, sexuality, disability, or gender. Diversity means understanding that everyone is unique. Everyone's differences should be accepted and respected, such as beliefs or race. Rights are what people are legally entitled to. Rights include choice. This means individuals having control over their lives. Confidentiality. Patients' information should be restricted unless they are at risk of harm. Protection from abuse or harm. There should be safeguarding procedures to ensure a patient's safety. Equal and fair treatment. Patients should be treated according to the law and their needs, regardless of differences. Consultation. Service users should have their opinions and views taken into account. Right to life. A person's life is legally protected and should be valued and respected. The benefits of diversity. Britain is multicultural, with residents from many backgrounds. Jewish and Irish people emigrated in the 1800s, followed by Caribbean people from 1948. The 1950s to 60s saw immigration from India, Pakistan and Bangladesh. East African, Asian and Vietnamese people followed in the 1970s. Eastern European refugees arrived in the 1980s. People who use health and social care will come from different backgrounds. You should be aware of any discrimination aimed at patients. You do, however, have to treat people who display this discrimination fairly. They may be in a vulnerable mental state and need support. Social and cultural benefits of diversity. There are many social and cultural benefits to diversity, which bring about cultural enrichment. Please follow the figure. The social and cultural benefits of diversity. The arts, such as foreign films, theatre, and museum exhibits, can bring diversity to a broad audience and can promote a greater understanding of other cultures. The range of food is another benefit of diversity. Foreign cuisine is extremely popular in Britain, which affects the food choices offered by the health and social care industry. Personal tastes, religious beliefs, and dietary requirements must be taken into account. Education now includes courses in different languages and cultures. People from diverse backgrounds and management positions affect positive change. All organizations need to provide training in equality, diversity, and rights. Being multilingual opens up new opportunities for health workers. People with a second language are in high demand due to non-English speaking patients. People in health and social care need tolerance. You must be professional, no matter your views or your patient's views. Close communities offer a safe and understanding environment. People stick together and help each other. In health and social care, this bond requires you to respect all your diverse team members. The economic benefits of diversity. Diversity brings many benefits to Britain, including clothing, food, imports, and exports. There are also new health and social care techniques being shared. The Health and Social Care Service is just one organization trying to reflect diversity in its workforce. This reflects the diversity of its service users. Health and social care settings. Residential care. When someone leaves their home to receive care in a secure environment, they may not need nursing care. This setting meets a person's social care needs, such as personal care, taking medicine correctly, arranging health visits, encouraging independence. Day care. This service is for people requiring daily care, but who do not require residential care. They have access to services such as physiotherapy, community day, center visits, healthcare visits. These service users may have day carers according to an assessment of their needs. Nursing care. Some service users may require nursing care if they are ill or have special health needs. Nursing care covers many treatments and patients. Specialist nursing care includes mental health nurses in hospitals or GP practices, as well as ward nurses and midwives. Domiciliary care. Some service users are treated at home, which may be their choice. Services include meal services, home visits, or giving birth. Active promotion of equality and individual rights. Health and social care workers must promote equality and an individual's rights. The principles of the care value base. There are 7 principles that make the patient the focus. The promotion of the anti-discriminatory practice. The promotion and support of dignity, independence, and safety. Respect for, and acknowledgement of, personal beliefs and an individual's identity. The maintenance of confidentiality. Protection from abuse and harm. The promotion of effective communication and relationships. The provision of personalized, individual care. These principles split into the following concepts: inclusivity, access, trust, confidentiality, choice, participation, honesty and openness, respect, safety. Anti-discriminatory practice, empowering individuals. To actively promote the anti-discriminatory practice, you might have to challenge individuals who discriminate, including colleagues and service users. This is not easy, but it can be necessary. You can seek support from your line manager or a trusted colleague. The health and social care profession empowers its staff by encouraging the promotion of individual rights. Individual rights. Rights in health and social care mean the underpinning principles of care practice. The right to be respected. Everyone has the right to be respected, and this is a key part of the health worker's responsibility. You must preserve people's dignity, core beliefs, choice, and privacy. You may become frustrated, but you still must respect their choices. Demonstrating respect requires listening and communication skills, patience, acceptance of choices, non-judgmental attitude. The right to be treated equally and not discriminated against. As you will work with a range of people, it is important that you do not discriminate. The right to be treated as an individual. This can be accomplished by recognizing and valuing difference. The right to be treated in a dignified way. People must be treated in a way that preserves their dignity and sense of self-worth. The right to be allowed privacy. Privacy is a human right. Patients should be able to expect that their treatment and care will be kept private. Their information will be confidential. Their dignity will be maintained during procedures. The right to be protected from danger and harm. Both you and patients have the right to be safe from any harm or danger. All settings require a health and safety policy as well as appropriate rules and regulations. The right to be allowed access to information about themselves. The Freedom of Information Act and Data Protection Act allow individuals to see their health records and information. If you are responsible for a person's health records, you should keep their records up to date and in order. Being able to quickly and easily find the information. Helping colleagues find information in your absence. Keeping the person safe and secure. The right to be able to communicate using their preferred methods of communication and language. Everyone has a preferred language, and it is important to use the right language to ensure effective communication. This may require interpreters and translators, which can be a strain on resources. The Discrimination Act requires reasonable adjustments to be made. Communication can be supported by employing multilingual staff, employing staff who speak the local common language, using interpreters and translators, using communication aids and different formats, seeing if the patient has a family member who can interpret. The right to have their choices taken into account and be protected. Patients have the right to select a hospital, select a care facility, select treatment. Discriminatory practices in health and social care. Basis of discrimination. A cause of discrimination is called the basis of discrimination, of which there are several. Culture. A person's culture is an important element that should be respected. Respecting a person's culture can create a sense of support and understanding, as well as improve their health. Disabilities. It is unlawful to discriminate on the basis of disability in many areas. There must be full accessibility for people with disabilities. Disability policies are legally required. Age. Age discrimination means that a person is being treated unfavorably or harassed due to their age. While there are debates regarding the use of expensive drugs on elderly patients, denying medication on the basis of age is a legal risk. Social class. Social class has an effect on health, such as an increased rate of cancer in poorer individuals. The Equality and Human Rights Commission states that everyone should be treated equally. Gender. The Gender Equality Duty 2007 prohibits unfair discrimination on the grounds of gender. Sexuality. Discrimination on the basis of sexual orientation is unlawful. Anyone feeling discriminated against due to their sexuality can seek legal help. Health status. It can be difficult to determine a person's treatment when taking their health into account. When making this decision, it is important to question your assumptions and prejudices. You should balance their patient's well-being with funding considerations. Family status. Discrimination can be leveled towards gay or lesbian parents, single parents, or parents of different races. Cognitive ability. Brain injuries, learning disabilities, social class, or education can lead to discrimination on the basis of cognitive ability. You should take care never to discriminate in this manner. Discriminatory practice. There are several behaviors that show discriminatory practice. Infringing a person's rights can cause them to feel undervalued, causing their health to suffer. Stereotypes and assumptions can affect a person's health care. Giving someone negative labels can affect the health and social care they receive. Bullying, either physically, verbally, or in writing, can cause distress and affect mental health. Abuse, through stress or lack of supervision and training, will negatively affect a patient's health and mental state. The effects of discriminatory practice in health and social care. Marginalization, treat a person or a group as insignificant. Someone may feel that they're not part of the main group. You should not marginalize anyone for any reason, including gender, sexuality, and health. Disempower, make a person or group less powerful or confident. Discrimination can lead to feeling disempowered. In some cases, this may lead to feeling depressed and devalued, as well as other health issues. Low self-esteem and self-identity. Discrimination can cause a loss of self-worth or self-esteem. This can be severe if someone already suffers from these conditions. As a health and social care professional, you should raise or maintain a patient's self-esteem as necessary. Restricted opportunities. Discrimination may cause someone not to use health and social care services, leading to a deterioration of their health. Negative behaviors such as aggression or criminality. Negative behaviors, aggression, or crime can result from discrimination. When experiencing hardship, people may take their frustrations out on people in a position of power, such as health professionals. People with anger management problems or drug users might also show negative behavior. How anti-discriminatory practice is promoted in health and social care settings. The active promotion of anti-discriminatory practice. Ethical principles. There are 4 ethical principles. Justice. All people should be treated fairly. Autonomy. People's choices must be respected. Beneficence. You should act in a way that benefits the patient. Non-maleficence. You must not do more harm than good. Putting the individual at the heart of service provision. To do this, a health and social care sector should actively support them in a way that aligns with their beliefs, culture, and preferences. They should also support and empower individuals while promoting their rights, choices, and well-being. Providing active support consistent with the beliefs, culture, and preferences of the individual. Active support involves supporting a patient as much as you can, while taking their preferences and beliefs into account. This support may be advice and guidance, medical and care planning information, physical support, social support, mental health. Mental health support, coping strategies. Anyone who needs mental health support should have access to social workers, community mental health nurses, occupational therapists, psychiatrists, psychologists, counselors, community support workers. Supporting individuals to express their needs and preferences. If an individual has difficulty communicating, such as being deaf, they should have supported such as BSL interpreters. The patient needs to be kept informed and allowed to express their views. Empowering individuals. You can empower individuals if you explain what is required for their care and ask them if they understand what they need. This gives them control and empowers them. Promoting individuals' rights, choices and well-being. You should offer a range of means for patients to communicate. The patient should feel that they are involved and valued. Balancing individual rights with the rights of others. This requires good organizational, negotiating, and communication skills. A support network of services is also necessary. Personal beliefs and value systems. Everyone has their own beliefs and value system. You need to make an effort to understand other people's influences on culture. People can have a strong cultural background, which influences how they communicate. You must respect the cultures of all colleagues and service users. Influences on beliefs. Beliefs develop at different times and from different sources, and they affect how we view ourselves. Everyone's beliefs should be respected, no matter what they are. Past events. You can be influenced positively or negatively by past events. These events can influence a person's behavior, and you should be aware of them. Socialization. Socialization, which is how we learn to socialize with others, helps us develop. It is a major influence on our lives. Environmental influences. The environment we grow up in has an influence on us. Class, money, and location has an unfair effect on access to healthcare provision. Health and well-being. Health and well-being influences how we develop and are viewed by others and ourselves. Labeling a person due to their health is counterproductive. Developing greater self-awareness and tolerance of differences. You should reflect on how you think of yourself and treat others. This allows you to become more aware. Committing to the care value base. You must be committed to the care value base. It is important that you know this before embarking on a career in health and social care. Careful use of language. You should always be aware of a person's communication needs and get support if necessary. You must be careful how you speak to colleagues and service users. Working within legal, ethical, and policy guidelines. It is vital that you conform to the laws and regulations governing healthcare. Summary. Over this module, we have covered the following information. It is important that everyone is treated fairly and equally, and the benefits of diversity should be acknowledged. There needs to be an active promotion of equality and rights in health and social care, and there are many aspects that should be understood. There are many negative effects of discrimination within the health and social care, which should be mitigated as much as possible.